I want to talk to you guys about a new study that has come out in the field of gender affirmation surgery, specifically top surgery, which is huge for the field. My name is Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon here in Miami, Florida. And so this study is much needed because, of course, gender affirmation care, unfortunately, has been really politicized in recent years. So we need good scientific evidence that these procedures work and indeed are medically necessary. There is a consensus among all the major medical associations in the USA that this is medically necessary work, but the more data we have to prove and back this up, the better. So this study was published earlier this month in the Journal of the American Medical Association, their surgical journal, really well-respected journal, has been around about 100 years and is an international peer-reviewed journal. So it's difficult to get your data into this. And this is wonderful work that comes from the University of Michigan. And so the thing that's so special about this study really is it captures long-term follow-up. So the minimum follow-up they have in this study is 2 years, but they have patients who underwent these surgeries more than 23 years ago. So it's really interesting to look at those patients and see how the surgery has helped their quality of life and if they have regret. So in this study, they had 139 patients and a 60% response rate for the survey. That may sound low, but in the world of medical research, that's a very respectable number, 60%, especially for such long-term follow-up as folks get on with their lives, and it can sometimes be really difficult to track down in the long term. So what they found was that top surgery really helps with quality of life. And the median satisfaction score was actually 5 out of 5, which is the highest satisfaction score the patient could give. The regret score was 0 out of 100. So not a single patient in this cohort regretted their surgery, which is quite unusual. We know from different studies in the past that about 1% of folks undergoing gender affirmation surgery regret it. But when you compare that to other fields, and we know this from other fields of surgery such as orthopedic surgery, spine surgery, cosmetic surgery, the average rate of regret for those surgeries is 14.4%. So with every decision in life, surgical or otherwise, regret happens. It's human to have regret. But the interesting thing about this surgery or this study is in the case of gender affirmation surgery, it seems to be incredibly low. This is really important. As I said, gender affirmation care and access to it has really been unfortunately politicized over the past few years. So well done to the University of Michigan for putting together this study and getting it published. And all we can do in the medical field is to continue to churn out the data to support this care. But again, really good study, and hopefully we'll see folks listening to the scientific data.